Okay, so I have my PPE on. While looking at the scene, I do see that there are needles and there are bottles that are broken around the patient. So first, what I'm gonna do is I'm gonna clear all the needles out of the way with the help of my partner, and I'm gonna dispose of them properly. There is a needle in the patient's arm, so we are gonna remove that as well, just so we don't get in the way of anything. So the nature of illness is, it was reported that this patient had overdosed and that they are unconscious. The number of patients is 1 so far. I am going to call ALS, and it doesn't look like the patient has fallen, so I'm not going to stabilize C-spine at this moment. So my general impression of the patient is very poor. Hi, my name's Lydia. I'm your EMT. So the patient is not responding. I think they are unresponsive. So the chief complaint is still that the patient is unconscious. So first I'm going to assess the airway. Okay, so the airway is patent. The patient is breathing, but they're breathing very slowly. It does look like it is equal bilateral chest rise. So I am going to put the patient on oxygen just because I'm worried about their breathing rate and how much oxygen they're getting. So then I'm going to look at the skin. So I'm going to check the pulse. Okay, the pulse is very low. So the pulse is at 48. The skin is pale, cool, and diaphoretic. And I don't see any major bleeding. So next, first I'm going to say this patient is definitely priority transport. So next I'm going to try to assess and get an OPQRST. So there's nobody around. This patient is unconscious, so I can't get OPQRST, I can't get sample, and I can't get any symptoms. I do suspect, since I do see drug bottles, pill bottles around here, and she did have a needle in her arm, that she has been using drugs and possibly alcohol as well, since there are bottles around. So next I'm going to take some vitals. So when I take the blood pressure is very low. It's 110/60. I already took the pulse, and the respiratory rate is 8. So next, my field impression of the patient is that she has overdosed. So what I would like to do is I'd like to call med control and see if I can administer Narcan. So I'm going to do that right now. So hi, my name's Lydia. I'm an EMT. I have a 51-year-old female who is unconscious. She was surrounded by pill bottles and had a needle in her arm, and I suspect that she is overdosed on a narcotic. I would like your permission to administer Narcan. Her pulse was 48. Her blood pressure was 110/60, and her respiratory rate is 8. So I would administer the Narcan intranasally, 2 spritz per nair, and then I would transport the patient immediately to the hospital. Okay, so I do have permission, so I am going to administer the Narcan. So I'm going to do 2 sprays per nair, and then I am going to transport the patient, lights and sirens, to the hospital.